Headaches are amongst the most common disorders of the nervous system. And according to the World Health Organization, globally, headache disorders affect approximately 40% of the population. And they're also more common in females than in males. This morning, in our Health Matters segment, we're going to take a closer look at the causes of headache disorders and when they become a threat to an individual's health. We are joined virtually for this chat by specialist neurologist, Dr. Bongani Ngele. Dr. Ngele, good morning. And thank you for making time to chat with us here on the SABC about such pertinent matters.
Good morning. Thanks for having me here.
Well, let's get straight into it. The majority of the global population have at some point in their lives suffered from a headache. It's a fair assumption to make at this point. And I wonder if you could really just define that phenomenon for us as we continue this chat.
All right. So headaches are one of the common conditions we see in our neurology practice. When you look at the global statistics, around 3 billion people globally suffers from headaches. And out of the 3 billion patients, majority of them are primary headaches. So primary headaches, these are headaches that don't have an underlying cause. And also there are secondary headaches which usually have an underlying cause. These are the types of headaches which obviously needs urgent attention and needs to be fully investigated.
Okay, thank you for distinguishing between...
Yeah.
Yes, do continue, do continue.
All right, so if we were to touch on the different types of headaches, the primary headaches, these are the headaches that don't have an underlying cause. The one common type of headache under the primary headache is what we call tension type headache. So tension type headache, it affects globally around 2 billion people. So this is the type of a headache that is influenced by environmental factors, the likes of stress, lack of sleep, poor diet, a lot of these environmental or psychosocial factors contributed to it. And usually this is a headache that feels like a tension in the head. It affects the whole head. And usually it can persist. It can be episodic. Episodic meaning that it affects one day of the month, or it can be chronic, which is mostly more than 15 days of the month. And then the second type under primary headaches is what we call the migraine headaches. Migraine headaches has a prevalence or predilection to affect females more than males, with a ratio of around 3 females being affected versus 1 male being affected. In terms of the cause of migraine, it has a genetic predisposition. So if you look at the research that has been done in migraine headaches, they did find that genetics plays a huge role in terms of causes. And how it presents, usually, these patients present with what we call a unilateral headache, meaning one side of the face. That is, in around 60% of patients have half their face being affected. And in around 40%, usually it's both sides of the head. It's usually associated with nausea. Hardly they have vomiting. And they have also photophobia, meaning sensitivity to light, and phonophobia, that is sensitivity to sound, and it's usually worsened by physical activity. So this type of headache, usually we classify it into 2 categories. We have the episodic. So this is when it's less than 15 days, a month of headaches. And then chronic if it's more than 15 days, a month of headaches. Some patients do have before the headache, they have preceding symptoms, what we call an aura, headache aura, which usually has a tendency to affect the eyes. In medical terms, we call it a fortification spectrum. So they have zigzag lines and flashing lights. That is around 75% of patients who have the aura preceding the headaches.
Dr. Ngele, I want to just get into the chat just on what you've echoed, and thank you for speaking to some of those stats that could be worrisome at this point because, we're wondering, why headaches? are underestimated, under-recognized, under-treated as well? And even if we're looking at self-treating, mechanisms, what are the dangers of self-treating headaches with over-the-counter medication? If we're looking at, what's emerging?
Okay. So what's so interesting is that majority of the patients I see in my rooms, majority of them, they come to my rooms, they have been self-treated or have been treated by their family doctors. The problem with that is there is what a condition called medication overuse headache. So the medication which is supposed to help you with the headaches, the likes of the Panadols, the Grandpas, the Brufens, that patients buy over the counter, can potentially worsen the headache. So instead of helping with the headache, when you overuse this medication, they can exacerbate the headaches. So that is something that people need to be aware of. Overdosing or buying a lot of medication from over the counter at the pharmacist can, instead of helping, can actually exacerbate their headaches.
I wonder if we're also just looking at the connection between headaches and seizures. Is this a warning sign preceding, such an episode? But even if we're looking at high blood pressure, hypertension, tell us a little bit more about what headaches could be indicative of as a warning signal.
Okay. That's a good question. Initially, I did mention the two classifications,
Yes.
the primary versus the secondary. Let's touch on the secondary. Secondary, these are the headaches that usually have red flags. We call them red flags. Red flags are things that people need to be aware of that can be indicative of serious underlying medical conditions. The one thing that people need to be aware of is a bleed. So usually when there's a bleed, the likes of subarachnoid bleed, a bleed is when there's a blood accumulating in the head. That is a medical emergency. So usually the headache is more like a thunderclap headache. It's the worst headache of their lives. Usually it will be associated with features of raised intracranial pressure. They'll have severe vomiting, more like projectile vomiting, neck stiffness, so that is a headache that immediately these patients need to go to the hospital. The other one is what we call idiopathic intracranial hypertension. That is when there's elevated pressure in the head. Usually this is a headache that predominantly affects females, patients who are within reproductive age. We're looking at second decade going to third decade, up to fourth decade. Why is that important? Is because these patients can lose their vision. They can lose vision, which is very, very important. So this type of a headache is usually worse on lying down versus on standing up. And they will have a visual blurring intermittently that is associated with the headaches. In terms of higher blood pressure, that potentially can give headaches. It can give a condition called PRES that can potentially also affect the eyes as well.
Dr. Bongani, thank you for weighing in and being part of this conversation. Of course, still more questions, but thank you for weighing in. But Dr. Bongani Ngele, specialist neurologist, chatting to us on this Health Matters segment about the causes of headache disorders and potentially how one could also treat them.